Often that can be changes with environment, skincare products, as well as particular ingredients. And these symptoms are often characterized by a sensation of burning, itching, stinging. The skin itself may look red, irritated, scaly, flaky, as well as having a rough texture. There certainly can be times where you're more sensitive, like perimenstrually. That has actually been shown where hormone changes can actually cause disruption in our skin barrier and leading to more sensitive skin. And then there are individuals who are just maybe more sensitive to particular ingredients like retinoids, vitamin C, exfoliants. And then there are individuals who have just sensitive skin all the time, all year round. And then at the other end, other side of the spectrum, I view medically as rosacea. And that is often not just characterized by sensitive skin, but actually redness, dilated blood vessel, as well as inflammatory bumps on the skin. There can even be like eye ocular involvement. So there's definitely a whole gamut, a whole spectrum of findings and symptoms that are characterized under sensitive skin. And certainly like there could be periods of time where like if you just went overboard with skincare products and you may not have sensitive skin really ever at baseline, your skin barrier can just be a little bit more disrupted, and thereby you may have just a little bit more sensitivity than normal. And usually that is just like a one-time thing unless you continue to be really aggressive with what you do to your skin. So with those things in mind, it can be very tricky when it comes to picking skincare products. And often when I see patients in clinic, when they complain about sensitive skin, whether it's just eczema-prone, dry, sensitive skin versus rosacea, one of the things I hear over and over again is just really hard time finding skincare products that works but also doesn't burn, doesn't sting on the skin. And that is really tricky and can be very challenging. And unfortunately, as a dermatologist even, there's really no way that I can predict how one will respond to a particular product. However, I'm really hoping this video I can give some guidance and recommendations to what I think can be helpful, what I personally have used when my skin barrier has been disrupted, when I'm sensitive, which I tend to get hormonally during that time of the month, as well as feedback that I've gotten from my patients with sensitive and rosacea prone skin. But really at the end of the day, regardless of what people recommend to you, you still want to, especially when you have sensitive skin, test it on your skin. You have to use it on your skin to really see if it works well. And often it is like a trial and error, and you may have to experiment with a lot of different products before you find one that works for you. And since we're talking about ingredients, again, there's no firm rule that you must follow when it comes to avoiding. And similarly, there's no best ingredients that you must have. It's all about what your skin can tolerate, what your skin needs, and the formulation of what works best for you. But in general, as a good rule of thumb, individuals with sensitive skin should avoid denatured alcohol because that's just very drying. And then fragrances of all sorts, synthetic or fragrances that come in the form of essential oils, for example. But again, not a firm rule. If you have sensitive skin, you've always used fragrance products and tolerate it, then by all means continue. And then other active ingredients that can be wonderful, but there's just